This is Late Night Health. This is the radio show and the video presentation that cares about the most important part of your life, your health. Hi, I'm Mark Alyn. We're joined, as we are each and every week, by Dr. Greg Celaya. Dr. Celaya is a chiropractor, nutritionist, and a functional medicine specialist. Dr. Celaya, welcome back to Late Night Health.
Hey, Mark, good to be back.
We're going to continue and actually, I guess, finish our series on eggs. I've always thought of eggs as being kind of one of the better foods to eat, but I guess we're going to talk about the not so good things about eggs today, correct?
Yeah, well, this is a third part of that series. And there's good things about eggs. Eggs are great foods, but there's bad for some people. You have about 2 to 3% of people that have sensitivity or allergies to eggs. And that can include rashes, congestion, flaky skin, runny nose, asthma, those type of symptoms. And so for those people, it may not be good. And it's really not that simple, but that's a good starting point for us to hit.
Well, I know that as we're recording this, the flu season is about to come upon us, and many of the flu vaccines are grown or manufactured, I'm not sure how they do it, with egg whites, with eggs. And if you're allergic to eggs, you're not supposed to take those kinds of vaccines. We have talked in the past about vaccines, good and bad. And I'm curious, what are the other bad things about eggs for the general population?
Well, for the general population, you hit it. Vaccines are an interesting part. But let's say, for example, you have low stomach acid. Well, you're not going to necessarily digest eggs correctly. And what happens is when you digest them improperly, you can get ammonia, which can irritate the central nervous system.
Yeah, well, ammonia, when you smell it, if you use it as a cleaning agent to disinfect, say, a sink or something, your body goes, whoo, like that, because we don't want ammonia, correct? We don't like it.
Yeah. And, one of the biggest issues that we have with eggs is the autoimmunity community. The autoimmunity scenario is where you have an exaggerated inflammatory response to proteins. And what happens is, for example, with eggs, if you think about the egg itself, it has a nice white outside, and that white outside is there to protect the yolk from many different things, but one of them is bacterial invasion. And so that white portion of protein is very high in proteolytic enzyme. One of them is lysozyme. And its main thing is to get in there and destroy bacteria that are coming into the egg. And we have a problem with that because when we go ahead and digest this enzyme, it's absorbed into our system, and other proteins like to piggyback onto that protein. And therefore, we end up with the molecular mimicry type of problem where these undigested proteins are now foreign invaders into our bodies. And there we have problems all over again with autoimmunity.
Dr. Celaya, what percentage of the population has autoimmune deficiencies or disorders?
Well, autoimmune disease is usually anywhere 1 in 5 or about 20%. Those numbers can fluctuate. And what people have problems with eggs, I don't know. But when I'm dealing with autoimmunity in a patient, one of the first things that we do is we change their diet. And one of them is to restrict eggs, just because we want to make sure. We can always add it back later, but it is an inflammatory issue if you do have a problem with eggs.
I was also thinking about cholesterol and eggs. The traditional health community goes back and forth. Every few years they say, hey, eggs are great. You can eat them every day. Then they say, no, you should restrict your eggs to a couple of weeks. Then they go back and say, well, you shouldn't eat them every day. It's very confusing. So the cholesterol factor in eggs, is that something that people need to worry about or not?
It's not anything you really need to worry about. In fact, some of the research now has come out showing that it's not a problem. But I think it's more not a problem if the egg is raised correctly. And we talked about that in some of the other videos. Some people can have gallstone issues as a result of eggs in the fat. There was a research project that was done that stated that eating an egg a day is about the same on your cardiovascular system as smoking 5 cigarettes. But when
my.
Yeah. But when you look at the research, it's pretty much about what we call persistent organic pollutants. And one of those is dioxin, which is an herbicide and paper bleaching byproduct. This toxin is stored in the fatty tissue. And the interesting thing is that we're finding this in eggs, in the yolk. But the good thing is that we have a high amount of vitamin A, which is supposed to downregulate dioxins. And so if the egg is raised correctly, we shouldn't have a lot of issues.
You said, I guess, about the shell. I'm interpreted something you said is that, we want egg shells to be white. Do they actually bleach the eggshells?
No. Dioxins, what happened is it's a byproduct of making herbicides and paper bleaching. So it has nothing to do with the egg itself. It's just a byproduct, and it's what we call a persistent organic pollutant. These are pollutants that are usually fat soluble, and we're finding them everywhere, and you can't get rid of them because they are fat soluble. We're finding them, like I mentioned, in eggs. And this is nothing really that is even inclusive in eggs. And it's not in every egg. It really depends upon how and what you feed your animals and where they're living, et cetera.
So we should look for, one, cage-free eggs, cage-free chicken. And if you're eating chicken, you should look for cage-free chicken, one. I know you suggest and recommend strongly clean or organic chicken. Anything else we should look for in our chickens and our eggs?
Well, cage-free is kind of a misnomer because I've seen plenty of pictures of ranches where you have all these chickens jammed in close together. There's barely any room to stretch. They're all standing on cement, and they're cage-free. So if you're going to do eggs, you want them, number one, to be organic, which usually means non-GMO, because you don't want those toxins in the food that they're eating. Because really, I think that the majority of problems we have with eggs are what we've done to create a problem with them as far as toxicity. So you got pesticides, you got the foods, and there's other things we'll talk about as well. And they need to be pasture raised. So they're out there running around, not necessarily in a cement enclosed barn, right, that is cage-free.
Well, the other night, I turned on the TV and Gunsmoke from the late 1950s showed up, and they were on a farm, and they had chickens running all over the place. And I thought, even though those chickens have been dead for 50 or 60 years since that show was actually shot, they were just running around scratching for their living.
Right. And that's the way that it should be. That's the way that eggs are meant to be. And we've taken it and we've commercialized it. And when we've commercialized it, we've caused problems. They did some research where they looked at the chicken livers and they looked at eggs, and they found that 20% of chicken livers and 10% of eggs had, I don't want to say pesticides in them, but medications for parasites. And so
can you explain what that means?
Right. They feed these birds different medications so they don't get parasites because they're living in such a tight environment. And so they're seeing that in the chicken and egg product as well, if the chicken's raised incorrectly.
Well, it says on all the packaging, and the FDA has said, or the USDA has said, no antibiotics can be used with any poultry products at all.
Yeah, and they may not necessarily be an antibiotic, right? So that's how they get through the whole thing. In fact, I just got a whole dozen of eggs, and on the side of it here, I'm just reading, it says, California shell egg food safety compliant. And these were organic, free range eggs. And, the intent was good, but what happens is when you start looking at the California compliancy, it means that there's some type of vaccine against salmonella. And they do that vaccine overseas, and it minimizes the salmonella issues. But, I don't necessarily want any type of vaccines in my chickens or my eggs.
Let's take a look at the care of eggs, which if you don't do it correctly at home, you can get salmonella and other poisoning from that. Am I correct?
Yeah, and that's what we talked about in the first video. It even starts with a cuticle, the outside layering of the egg itself, and what happens is when you cool it and versus not cooling it. Like, for example, overseas, they don't cool their eggs. In fact, They don't refrigerate them. Let me get that straight. So they may cool them down to about 68 or 72 degrees, but they don't refrigerate them like we do. And the problem with refrigerating them is that once you do it, you always have to do it because now you have a problem. So the cuticle has been washed off or treated off with different types of soaps, detergents, whatever have you, chlorine type of baths. And now the cuticle's gone. And when you do that, you end up having a problem because now you're cooling the egg. And if it does not maintain its temperature, you can have bacterial presence enter the egg. So whoever's interested in that should go back and look at that first video on how eggs were processed.
And are there any other reasons that people should not eat eggs? Are there other bad problems with consuming eggs?
I think it all comes down to moderation, right? It's like I talk about every single week. Let's just say, for example, our eggs are polluted, and it's not just eggs, it's everything. So for example, that research study that showed dioxins in eggs, well, there's dioxins in vegetables, there's dioxins in everything. It's not just eggs. And so we've got to be very careful in what we consume because we've pretty much polluted our earth, and it's everywhere and it's in everything. And if you do too much of one thing, you're going to increase those toxins more so than you may on a normal basis. It may not necessarily even be that simple. I think it's for you.
It is. Not answering it.
Oh, okay.
Okay. I can't do anything. I thought I unplugged it.
Oh, well, that's the way it goes.
Okay.
You know, there's another concept called hormesis. I don't know if you've ever heard of that before.
I have not.
Okay, hormesis, I mean, it's kind of complicated, but it basically states that if too much of something is not good for you, a small amount may be okay and it may be beneficial because it helps stimulate your body's detoxification pathways. So, you know, I'm a little concerned about everything and all of my food, and you and I both know so many people that are sick, ill, and dying with different diseases, either autoimmunity or cancer or even heart disease. What is it that we've done to our system to create some of these things to occur? But, you know, are we okay consuming small amounts of these toxins as a result of increasing our ability to detoxify them? I don't know. All I know is I want to try and reduce my inflammation, and I eat everything in moderation. And even though eggs are a wonderful, wonderful food, they're not good for people that have allergies and people that have autoimmunity. So those two people right off the bat, I would stay away from eggs. But for the rest of us, eat eggs in moderation. And that's the big thing. Don't eat them every day. I know people that eat 2, 3, 4, 5, 6 eggs every day. And I wouldn't suggest eating meat that often as well, right? The same kinds of meat or the same kinds of vegetables. The same goes for eggs.
Well, as we wrap up our series on eggs, of course, I have to ask you the question. You know what that question is?
No, tell me the question.
Which came first?
Oh,
the chicken or the egg?
Yeah, go figure. Hey, you know, one more thing. I thought about one more thing. Cancer patients usually are told to stay away from eggs if you're being treated naturally for cancer. And so is it the choline? I'm not sure. Tumor, nodules, PCOS usually should stay away from eggs as well.
Oh, interesting.
But chicken or the egg? Yeah, I don't know.
Well, one of them came first. We just don't know. Dr. Celaya, thank you very much. If you would like information on Dr. Celaya, join him at drcelaya.com. That's drcelaya.com. Look around, lots of great information. Plus, you can ask him for a free 15-minute consultation over the internet. That's a real wonderful offer, a free consultation with Dr. Greg Celaya. So go to drcelaya, drcelaya.com. And of course, visit us at latenighthealth.com, latenighthealth.com. For Dr. Celaya, I'm Mark Alyn. We'll see you on our next episode.